Hello friends, welcome to Creative Medicine. In this lecture, we will learn about schizophrenia with late onset and best prognosis is. Okay, late onset and best prognosis. Okay, uh, simple schizophrenia has worst prognosis because in simple schizophrenia there are most commonly negative symptoms are seen, so it has worst prognosis. In hebephrenic schizophrenia, personality is affected first, and as a result it is early onset schizophrenia, but it has poor or bad prognosis because of the deterioration of personality. In catatonic schizophrenia, it is actually early diagnosis is done because of motor symptoms will result in early diagnosis, and it has best prognosis. In paranoid schizophrenia, it is actually a late onset schizophrenia, but because there is mainly positive symptoms are seen in the patient, it has good prognosis. So here the answer is paranoid schizophrenia, which has late onset and good prognosis. Thank you, and thank you for watching.